right, so a new study finds that COVID-19 immunity, the natural kind caused by getting the virus and then beating it, can be just as protective as getting a vaccine.
The study published in The Lancet found infection-generated immunity can cut the risk of hospitalization and death from COVID-19 by up to 88% for up to 10 months.
Dr. Stanley Perlman joins us now with more. He's a distinguished chair at the University of Iowa, speaking of Iowa, in the departments of microbiology, immunology, and pediatrics. Thank you very much for being here, Doctor. Your big takeaways from this study?
Well, first, thank you for having me. My takeaways from the study are really that a natural infection works pretty well in preventing hospitalization on subsequent rechallenge. This is not a complete surprise. This is what we expect immunity to infections to do. The parts of this study that I think raise questions or that are interesting is the question of how does it compare to vaccination?
Right.
And what this study does is it compares protection for those who have been immunized with the basic two-shot series versus this reinfection, and the reinfection does a little better. But I think, as we all know now, people have received boosters, particularly the first booster is considered very important for protection, and the second booster may help some, particularly against the new Omicron-type variants. So you put this all together. Oh, sorry, go on.
Well, I was going to say, it sounds like you were building to it. I mean, bottom line, do people still need to get boosters and vaccines if they've already had the virus and therefore have immunity?
Yeah, so I think that is the question, and I think it has to be a nuanced answer, because what we know is that for many people, being infected and maybe being re-boosted by getting the infection again may protect them. But there are groups for whom this is not true. People who have never been infected or vaccinated can still get very severe disease. And we have to remember that this was the strategy that was used in Sweden initially, and what it ended up with was a lot of people dying. Because the infection is still bad. We still have 500 people a day dying in the U.S. And most of those people are either babies who have never been vaccinated or older people whose immunity isn't great or people who don't have a good immune system.
Now, Dr. Perlman, the study did not include hybrid immunity, which, as I understand it, comes when someone contracts the virus and is also fully vaccinated. Is that, I guess, the ideal level of protection?
I don't know what ideal is. I think if one is vaccinated, if one has been infected and it's done well and then vaccinated, that seems to work well. The reverse seems to be good as well. But the challenge with this virus is even with immunity, whether it be from a natural infection or from vaccination, people are still getting reinfected. Yeah. So they're not going to the hospital and they're not dying, but there's still lots of infections around.
That's right. Well, Dr. Stanley Perlman, thank you so much.
Yeah, thank you.
My pleasure. Thank you.